Have you ever wondered what rheumatoid arthritis is and why it affects so many people around the world? Rheumatoid arthritis, often simply referred to as RA, is a chronic inflammatory disorder that can affect more than just your joints. It's a systemic disease, meaning it can impact the entire body. This widespread condition is prevalent across the globe, impacting millions of lives daily and significantly influencing their quality of life. RA is a complex, multifaceted condition with a range of causes, symptoms, and treatments. It's a world where the immune system turns on the body it's meant to protect, leading to inflammation and damage in the joints and other organs. In this video, we'll delve deeper into these aspects, exploring the intricate workings of this disease, unpacking its causes, recognizing its symptoms, and investigating the various treatments available. So, buckle up as we journey through the complexities of this fascinating and widespread condition. First off, what causes rheumatoid arthritis? Diving right in, let's talk about the immune system. It's the body's defense mechanism protecting us from infections and diseases, but sometimes it gets a little confused. In the case of rheumatoid arthritis, the immune system mistakenly turns against our own bodies, specifically targeting the joints. This unwarranted attack leads to inflammation and pain, the hallmarks of this condition. When we think of joints, we often picture the hinge-like structures that connect our bones, allowing us to move freely. The immune system, in its misguided assault, targets the synovium, the thin layer of tissue lining the joints. Over time, this persistent inflammation can result in joint damage and loss of function, and it's this process that underlies the discomfort and disability associated with rheumatoid arthritis. Now, you might be wondering, what triggers the immune system to go rogue? Well, the exact cause remains a mystery, but several factors can increase the risk of developing rheumatoid arthritis. Genetics play a significant role. If your parents or siblings have the disease, your chances of developing it are higher. But remember, genes aren't destiny. Having a family history doesn't guarantee you'll get rheumatoid arthritis. It just means you're more at risk. Age is another factor. Rheumatoid arthritis can occur at any age, but it most commonly starts in middle age, between 40 and 60. And let's not forget about lifestyle factors. Smoking is a major one. Not only does it increase the risk of developing rheumatoid arthritis, but it can also exacerbate the severity of the disease once it's established. So, to wrap it up, rheumatoid arthritis is caused by a combination of a misdirected immune system, genetic predisposition, age, and lifestyle factors like smoking. Understanding these causes helps us to better comprehend why certain people are more susceptible to this condition than others. But how do you know if you or someone you know has rheumatoid arthritis? Let's dive into the world of symptoms. Rheumatoid arthritis, often referred to as RA, manifests itself in a variety of ways. However, there are a few telltale signs that are commonly observed among those affected by this condition. The first, and perhaps the most prominent symptom, is joint pain. This isn't your everyday aches and pains after a long day at work or a rigorous workout. This is a persistent pain that doesn't seem to go away no matter how much rest you get. It's like a dull, throbbing ache that seems to radiate from the very core of your joints. Next is joint stiffness. Have you ever woken up in the morning feeling as if your joints are locked in place? With RA, this stiffness can last for hours and is typically worse in the mornings or following periods of inactivity. It's as if your joints have forgotten how to move smoothly and freely. Another symptom is joint swelling. This is when your joints appear larger than usual due to inflammation. It's like your joints are being inflated from the inside, causing them to bulge outwards. This swelling is often accompanied by a warm sensation, as if your joints are radiating heat. And then there's fatigue. This isn't just feeling a little tired after a long day. It's a sense of exhaustion that seems to seep into your bones, making even the simplest tasks feel like monumental challenges. Remember, these symptoms can vary greatly in severity from person to person. Some may experience mild symptoms, while others may have more severe manifestations. Similarly, these symptoms may not be constant. They can come and go, with periods of increased disease activity known as flares, followed by periods of relative calm or remission. Recognizing these symptoms early can lead to quicker diagnosis and more effective treatment. So if you or someone you know is experiencing these symptoms, don't hesitate to seek medical advice. It could make all the difference in managing this condition effectively. So what can be done if you or someone you know is diagnosed with rheumatoid arthritis? Well, fear not, because medical science has come a long way and there are several treatment options available to manage this condition. We'll delve into these options, keeping in mind that the primary goal of treatment is to manage symptoms and prevent further joint damage. First on the list are medications. The most commonly prescribed drugs for rheumatoid arthritis are disease-modifying anti-rheumatic drugs, or DMARDs for short. These work by suppressing the body's overactive immune response, which is the root cause of inflammation and joint damage in rheumatoid arthritis. Methotrexate is one such DMARD and is often the first choice of treatment. Biologics, a subset of DMARDs, are also used when traditional DMARDs are ineffective. They target specific parts of the immune system to curb inflammation. Non-steroidal anti-inflammatory drugs, or NSAIDs, and corticosteroids are another two types of medications used to reduce pain and inflammation. Now, let's move on to physical therapy. A well-designed physical therapy program can significantly improve a patient's quality of life. It can increase the range of motion, enhance strength, and reduce pain. Physical therapists may use different techniques like heat or cold therapy, massage, or water therapy. They might also recommend assistive devices to make daily tasks easier. In some cases, when medication and physical therapy aren't enough, doctors might suggest surgery. The goal here isn't to cure the disease, but to repair damaged joints, reduce pain, and improve function. Joint replacement surgery, where a damaged joint is replaced with a prosthetic one, is quite common. There's also joint fusion, where the ends of two bones in a joint are fused together, leading to increased stability but limited movement. It's important to remember that every individual is different, and so the treatment plan should be personalized, taking into account the patient's overall health, the severity of the disease, and their lifestyle. Regular checkups and constant communication with healthcare providers is a must to monitor the disease's progression and adjust the treatment plan accordingly. And lastly, healthy lifestyle choices can't be overlooked. Regular exercise, a balanced diet, adequate sleep, and stress management can all play a significant role in managing rheumatoid arthritis. While there is currently no cure for rheumatoid arthritis, these treatments can significantly improve quality of life and slow the progression of the disease. Let's summarize what we've learned about rheumatoid arthritis. This is a chronic inflammatory disorder that primarily affects the joints. It's not just an ailment of the elderly, as it can occur at any age, but it's more common in women and often presents itself between the ages of 30 and 60. We've delved into the causes of rheumatoid arthritis, although it's important to remember that the exact cause remains unknown. However, it's widely accepted that a combination of genetics and environmental factors, such as smoking or exposure to certain types of bacteria and viruses, can trigger the immune system to attack the body's own tissues, leading to inflammation and joint damage. As for the symptoms, they can vary from person to person and may come and go. However, most people with rheumatoid arthritis experience prolonged periods of symptoms, including joint pain and stiffness, especially in the morning or after periods of inactivity. Other symptoms may include fatigue, fever, and weight loss. Remember, these symptoms can be subtle and can often be mistaken for other conditions, which is why it's so important to consult a healthcare professional if you're experiencing them. We also explored the commonly affected areas, which are usually the small joints of the hands and feet. But rheumatoid arthritis can affect any joint in the body and can also damage a wide variety of body systems, including the skin, eyes, lungs, heart, and blood vessels. When it comes to treatment, there's no cure for rheumatoid arthritis, but various treatments can help manage symptoms and slow the progression of the disease. Treatment options include medications, physical therapy, and in some cases, surgery. Lifestyle modifications, such as regular exercise, a healthy diet, and adequate rest, can also play a crucial role in managing the disease. Finally, we discussed the importance of early detection and diagnosis. While there's no single test to diagnose rheumatoid arthritis, a combination of physical examinations, blood tests, and imaging tests can help confirm the diagnosis and guide treatment decisions. Remember, early detection and treatment can make a world of difference when it comes to managing rheumatoid arthritis. don't hesitate to consult a healthcare professional if you or someone you know is experiencing these symptoms.